Mr. Chairman, thank you very much. Let me start with let me first say that I'm going to depart our hearing as soon as my questions have been answered. But I would pay honor in this setting to Senator Dole, who we will all be in the Capitol to honor today. In Kansas and perhaps the country, there's no more esteemed public servant, but in my view, while his public service was tremendous, his military service and then his commitment to those with disabilities and the veteran community is exemplary. No one meets that standard, and so I pay a tribute to Senator Dole. Let me just raise a few points, and then I'm going to make a comment and ask a question, Mr. Secretary. First, I want to note that your cancellation of the contract for Region 4 for community care troubles me. I understand that Senator Heller is going to raise this topic with you today. You have a request from my subcommittee on appropriations to explain what happened in that regard, and I look forward to that answer. Secondly, I'll be submitting several questions for the record. I'm interested in knowing the VA's efforts in regard to full implementation of the Toxic Exposure Research Act, something that Senator Blumenthal and I sponsored and became law in December of 2016. And then finally, you've had conversations with me about electronic health records, originally about a reprogramming, and now I see that there are other reasons that you're not proceeding, and I'm concerned about what's taking place here, and I've sent you a letter, and I would ask you to respond to it. Then let me talk about the topic that the chairman mentioned in regard to the bill that passed the committee. I want to direct this not to the chairman, but to you, Secretary Shulkin. I've been working closely, in my view, with the chairman and the ranking member, other members of this committee, and those in the VA that you designated for me to work with, and with the White House to make certain that the future of community care for veterans works well for veterans and the providers who serve those veterans. It's of utmost importance to me to reform choice and to pass the right policies that will work for veterans in accessing health care that they deserve. It's also critical that members of Congress continue to push for a change in the VA culture and to promote implementation of policies directed by Congress instead of the VA often narrowing the scope and thwarting the intent of Congress. This is, in fact, the conversation that you and I had almost exclusively during your confirmation hearing in February of 2017. Pushing for a culture that transforms the VA, in my view, we have to hold you and other VA leaders accountable. And in my view, too often commitments and pledges that are made to this committee and to individual members regarding legislative efforts on behalf of our veterans, the follow-up, the experience is typical of what I've found with implementation of congressional passed legislation. The VA changes course and it thwarts the intent of Congress. You and I had this conversation during your confirmation hearing. On numerous occasions, you and I have met in my office. We have had numerous telephone conversations, and in those meetings and in those telephone conversations, you expressed support for access standards in the eligibility of choice reform. In every instance, in my view, you led me to believe that you and I were on the same page. What I remember you saying is this: the need for specificity in legislation is there, and then I quote you, if it's left to the reg process, nothing in the VA will change. You told me that. I learned, though, that you have said something quite different to the chairman and to the ranking member, and I'm of the opinion that our inability to reach an agreement is in significant part related to your ability to speak out of both sides of your mouth, double talk. My understanding is that others have had this experience, and there is a shared frustration about this circumstance. So, Mr. Chairman, you have been sworn to give testimony today. I'm looking for a straightforward answer. A yes or no would be good. Do you believe that the eligibility criteria to determine if a veteran can receive care in their community ought to be explicitly linked to the access standards? Yes or no?
Of course I believe that eligibility criteria should be explicitly linked to access standards, and I believe that those access standards need to be developed by the VA.
And Mr. Chairman, then, Mr. Chairman, let me ask the Secretary, You support the access standards that are in our bill. You've told me that, true?
I support the access standards that are in the bill that the Senate committee passed 14-1.
And those access standards are very similar. The issue is whether they are then tied to eligibility. Why would you not tie the access standards to eligibility? Why have access standards if they don't matter in who is eligible for community care?
Well, Senator Moran, first of all, I applaud your efforts to get this right. I think it is grossly unfair to make the characterizations that you've made of me, and I'm disappointed that you would do that. But I think that I do not disagree with where you want to get to. I do believe that it is our job to give veterans more choice about how and where they get their health care. I think the issue is that I am trying to do this in a way that will work for veterans and work for VA. I've seen, as you said before, Congress pass legislation that makes it more complicated and that makes it not work for veterans. And what I am trying to do is give you my best advice about how this works. The best way that I know how to do it is the way that the committee, 14-1, passed their vote. And I do believe that because of your efforts, we can make those eligibility criteria, those access standards, clearer to veterans so they understand it. That should be our goal. And to make sure that they do have choice based upon their clinical needs of their condition. That's what you do in a healthcare system. That's what I'm driving to get at. I don't believe that we are at a faraway position here. We're now talking about the best way to implement what we all want for veterans, which is the best care and giving them the most choice that they can get in that care.
Well, Mr. Secretary, I'm sorry that you you're disappointed in my approach to this, this hearing today. I chose my words intentionally. I believe it to be the case. I think you tell me one thing and you tell others something else, and that's incompatible with our ability to reach an agreement and to work together. And I intend to be a member of Congress who holds you accountable for what you tell me. I hope the next step is, the chairman indicated that the White House was sending language. I certainly would welcome a conversation, a discussion among the members of this committee, the ranking member and the chairman, the White House and you. This is, as you say, not that difficult, but it is an important issue. It's not one that's just a matter of a few words. It matters in the result that we get for accountability at the VA. Mr. Chairman, thank you for the opportunity to question the witnesses.